Hi everyone, in this video we are going to discuss about qualities of a critical care nurse. I am Julian K. Thomas, faculty working in M College of Nursing. The objectives of today's discussion include the group should be able to define the term critical care, brief the qualities of critical care nurse and enumerate the skills to be possessed by critical care nurse. Critical care nursing. So, what is the definition for a critical care nursing? So, critical care nursing is defined as it is a specialty within nursing that deals specifically with human responses to life threatening problems. So, what is a critical care nurse? Who is a critical care nurse? So, critical care nurse is defined as a licensed professional nurse who is responsible for ensuring that all critically ill patients and their families receive optimal care. Critical care nursing. What are the characteristics of a critical care nurse? So, if we want to recruit a critical care nurse, what are some of the points we have to keep in mind? So, the characteristics include first one is technical qualification. So, if a nurse want to work in a critical care unit, she should be technically competent to handle all the equipments what is present in a critical care unit. That is technical qualification. She should possess a valid educational background, either a BSc or an MSc nursing. Then she should have a sound clinical experience in the critical care unit, or a novice nurse also can be work in a critical care unit, but we should make sure that she should have a 6 months of induction course. So she is thoroughly knowledgeable about the critical care unit. Okay, then only she should have a patient assignment in the critical care unit. Then she should have a sound knowledge on critical care nursing. What are some of the qualities of a critical care nurse? The qualities of the critical care nurse includes intelligence and common sense. A nurse should possess intelligence as well as common sense. We know intelligence is the ability of a person to acquire and apply the knowledge and the skills what she has learned. And common sense is a sound judgmental in practical things, how they are going to see the things in the practical way. And also they should possess good physical and mental health, alertness and love for fellow human beings, technical competence, dependability and adjustability. As a nurse, when they are working in a critical care unit, they have to depend on other healthcare members, and also they have to adjust in the healthcare settings. Ability to inspire confidence, resourcefulness both in the practical aspects and in the theory aspects, tact and poise, self confidence, coordination for others, ability and the capability of the person, cooperation, professional responsibility, and genuineness and honesty. How genuine and honest is the person in the working area? The other qualities of the critical care nurse include immediacy in communication. How fast is she in communicating things with the healthcare professionals? Sensitive confrontation, good workmanship, selflessness, courage, sense of humor, patience, and willingness to learn. Always a critical care nurse should have the willingness to learn whatever comes in her way. So she has to take up all the learning experiences in a positive way. So, to conclude, we can say that these are the 10 important qualities a critical care nurse should possess. A critical care nurse should have a caring nature, an empathetic attitude, always detail oriented, emotionally stable. She should be adaptable with all the working situations, hardworking, quick thinker, physical endurance, good judgment, and always she should possess a good communication skills with the patient as well as the healthcare professionals. So far, we have seen the qualities of a critical care nurse. So now we are going to discuss about the skills of an ICU nurse. What are some of the skills an ICU nurse should possess? So the first one is the passion for the job. The nurse who are working in an ICU or a ward, they should have the passion towards the job. Passion for work is the intense enthusiasm and excitement for what they do. So it can be different from doing it and getting done well. So always we should have an interest or the passion towards our job what we are doing. Unless we are not having a passion towards the job, we cannot get 100% satisfaction from the work. The second one is the technical skills. So the nurse should be competent enough to handle the technology in an ICU setup. So the technical skills, which are a sets of abilities or knowledge used to perform certain practical tasks. Maybe an infusion pump will be there, a ventilator will be there in an ICU. The nurse should be proficient and competent enough to handle the technology which is present in the critical care unit. When a nurse is working in an ICU, the third skills what she should possess is the ability to work as a team. So when she is working as a team in an healthcare unit or in a critical care ICU, she should know how to move along with the people those who are in the critical care unit. So the teamwork skills involve your ability to work well with the others, so which can include your communication, your listening, your collaboration skills, how you are good in conflict resolution and the interpersonal skills. So as a nurse, she should know how to go with the other workers, those who are working along with her, how to work as a team and get the work done. The fourth skill include organizational skill. When a nurse is working in an ICU or in the critical care unit, she should know how to organize her work and to complete her task on time. So organizational skills are some of the abilities that make a person to stay focused on different tasks. So how to utilize the time, how to utilize the energy, the strength, the mental capacity and the physical space, how effectively and efficiently to achieve the desired outcome, what she is supposed to do within the desired time, how she can achieve the task. So that is nothing but the organizational skill. How far the nurse is good in achieving the organizational skills in the working environment. The other skills of the ICU nurse include, the fifth one is ability to evaluate ever changing situations. So the ability to evaluate ever changing situations, the term is nothing but adaptability. So how easily a nurse adapt or adjust to the changing circumstances. In ICU circumstances, we know that anything can happen at any time. So how the nurse is able to adjust or adapt to the situations what is happening around with us. So an adaptable person in the workplace, she can keep up with the moving priorities, the patients and the technology what she is handling. So she is always skilled at dealing with the changes in the work, whether the process update or their work environment. So as a nurse, always we have to be adaptable, which means we should be flexible and are also able to adjust to the new situations what is coming up in our life. Sixth one is tenacity in the face of difficult situations. So tenacity is nothing but the word which refers the ability of a person to handle the obstacles or the difficult situations and how they are building up the confidence within them to achieve the success. So that is nothing but the tenacity. How far we are strong and confident in handling the difficult situation. So as we all know, this critical care unit or ICU is a place where the things will change in a fraction of seconds. So how we are going to face that difficult situation or that hard situations, are we capable enough to handle the situations, whether we are having that critical thinking to overcome that situation. So that is nothing but tenacity in face of difficult situation. So whatever difficult situations come up in the working area, as a critical care nurse she should be skilled enough to handle such obstacles and to move on. Seventh skill of an ICU nurse is the problem solving skill. So, problem solving skills are always appropriate for the patient care because it is important to deal with the complexity of the environment that support the workers can find themselves. So, always when we have a problem, we have certain steps to analyze the problem and find out the solutions, which include identify and define the problem. We need to analyze what is the problem. So develop certain solution to solve that problem, analyze and select the best solution, implement the solution and evaluate the solution. So if the solution, if we have found good, we have to implement into the patient side. So always when a nurse they are working in the critical care unit, they should know how to solve a problem which comes in their way. And the eighth one is the clinical skills. How competent are a nurse in their clinical skills? So when a nurse is working in an ICU, she should be competent in her practical skills, starting from the basic hygienic care till the technologically handled competent skills. So always make sure that when a nurse has to be work in an ICU or the critical care nurse, she should possess competent clinical skills. Ninth one is communication skills. So as we all know, the communication, that is the way how we are going to exchange our ideas with our patients or the patient relatives or with the healthcare system. So a good communication between nurse and the patient is essential for the successful outcome of individualized nursing care of each patient. So if we want to achieve this, however, the nurses must understand and help their patients, demonstrating courtesy, kindness, and sincerity. So always we should have a good therapeutic communications with the patient. Without making or without having a good communication with the patients, we cannot achieve 100% a result or desired outcome from the patient. And also we should maintain a good communications with the healthcare members or the friends, those who are working with. There should be an interpersonal relationship, intrapersonal relationship. So the communication is an important keystone when we are working in it, not only in the critical care unit. So everywhere we work as a nurse, communication is an essential skill. The other one is the assessment skill. The 10th one is assessment skill. So assessment is nothing but we are going to just check on the patient. So we have different types of assessment. So when we are working in a critical care units, what is the importance of assessment? So the patients will be deteriorating in a fraction of seconds. So as a nurse, we should identify any changes in the normal or any changes of deterioration can be easily identified by the nurses, and early treatment or early medication should be provided for the patients to prevent complications. So the critical care nurse should be competent enough in assessing the patient conditions and ruling out what is the problem at the earliest and provide care accordingly. The other skills include interpersonal relationship or interpersonal skills. So when a nurse is working in an ICU or a critical care unit, she has to cooperate with the doctors, the physiotherapist, the nutritionist. So she should have a good, effective communications or relationship between the people whom where she is working with, maybe with their own in charges or the colleagues. So always they should have a good relationship or communications between the people with whom they are working. And the 12th one is the decision making skills. So a critical care nurse or an ICU nurse should take the decision in a very prompt or in an accurate way. So how skillful is a nurse in making decisions in relation to the patients? And 13th one is the observational skill. So how a nurse should be a keen observer in the critical care unit. So in nursing, we have certain ethical principles to be followed. So the 14th point is the ethics. So certain ethical principles in nursing include autonomy, beneficence, fidelity, justice, non-maleficence, and veracity. So these are certain principles the nurses has to follow when she works with the patients and with the healthcare professionals. So autonomy is nothing but the respect for an individual right to make their own decisions, how much she is able to take decisions by her own. The beneficence is the quality of doing good, how far she is doing good things for the patients as well as for her fellow beings. Fidelity is nothing but the loyalty and the promise what she has given to a patient or to the colleagues. Justice, fair and equal treatment for all, non maleficence, never doing harm to any patients, those who take care. And veracity is nothing but the honesty when dealing with an individual, how honest the nurse is. So these are certain ethical principles the nurses has to follow when they are working in the uh, working in a hospital or in the healthcare professional. So ethics within the healthcare are very important because the workers must recognize the healthcare dilemmas, what is there, make good judgments and decisions based on their values while keeping within the laws that govern them. So always we should be accountable of what we are doing. So that is the importance of ethics in the nursing. 15th skill is the professionalism. So professionalism in nursing is very important. The professionalism in nursing means providing top quality care to the patient, while also we have to uphold the values of accountability, respect and integrity. So why we have to follow professionalism in nursing? So this is very important in nursing because it ensures that the nurses achieve the highest standards of care for the patients. Professionalism also helps the nurses can directly for their patients and work effectively as a part of team. So always the nurses will provide high quality care for the patients when they hold the term the professionalism. So the next skill include the critical thinking skill. So the thinking skill is a very important skill among nurses. So it defines that the critical thinking is necessary for the problem solving and decision making by the health providers. So it is a process where people use logical process to gather information and they will take purposeful action to find solutions based on their evaluation. So whenever there is a problem, we have to evaluate it carefully by observing the problem, analysis, inference, then communication, and the problem solving. So, this critical thinking is a very essential skill of an ICU or a critical care nurse. So, we know the patients will be in a critical state, so their conditions will be deteriorating very fast. So, we have to identify what is the problem in the fraction of seconds, and we need to critically think, analyze, and we should bring out a solution for that problem. So, the nurses should be competent enough to handle the situations in the critical care unit. The other skill includes the physical abilities and the self care. So the nurse should be physically strong and mentally strong to handle the situations in a critical care unit. So she should take care of herself mentally and physically to give care to her patients. The other skill includes the emotional stability. So, what is an emotional stability? Emotional stability enables the person to develop an integrated and balanced way of perceiving the problems of life. So, this organizational ability and the structured perception help one person to develop reality oriented thinking, judgment, and evaluation abilities. So, whatever problems comes up in the mind, so they will think what is the actual problem. So, is it valid, so how I have to react on this problem. So whenever a nurse is working in an ICU or the critical care unit, she has to face a lot of emotional disabilities in the ward with the patient as well as with the healthcare professional. So as a nurse she should manage all her emotions and she should have an emotional stability during the work time. The other one is the delegation. So, delegation generally involves assignment of the performance of the activities or tasks related to patient or patient care to other professionals, those who are working along with them. So, always as a nurse, she should know her cadre and she should know how to delegate the work and how to delegate the work and get things done. So always as a nurse, as a single person, she cannot do all the work in the critical care unit. So she has to allocate the works to the juniors or to the person those who are next to her, those who are helping her. She has to delegate and get the things done. The other skill includes the time management, how effectively a nurse has to manage her time. So, always have an organizational skill, organizing things in the correct order so that she can save the time. The other one is the computer literacy. So, we know in this developing era, so everything is going into the computer system. So, the paper and pen is going to be removed from the system itself. So all the nurses should be aware about the computer, how she has to use the computer, how she has to work with the computer. So the computer literacy is very important skill of a nurse if she want to work in an ICU or in the critical care unit. And the last one is the research. Research doesn't mean that only the higher professionals or those who are having high degrees only should do. It doesn't mean that it means that the research, whenever or wherever or whatever is the situation, when small problems comes, as a nurse, it is their responsibility to analyze what is the problem, try to bring up some solutions for the problem. So in such a way she can do small project in her bedside itself. So the nurses should be competent enough to identify the problems, and she should know how to solve the problems. So always the nurses at the bedside should try to do some researches in their working times. So far we have discussed about what are some of the skills and qualities of an ICU nurse. So how to improve ICU nursing skills? So always we should get familiar with the technology, work on with our communication skills. Always we should find a mentor or a person those who can help us in the difficult times. Stay up to date on the medical trends, what is happening around us, what is the technical advancements, or what are the clinical changes, what is happening around us. Always stay up to date on the medical trends. Look for ways to use your critical thinking skills whenever possible. So these are some of the points where we can improve the skills in the ICU setups. So to conclude, we can say that a critical care nurse needs to be strong to get through tough situations, but always have a caring heart. Thank you.